Welcome to this guide on gout, a common but often misunderstood form of inflammatory arthritis. In the next few minutes, we will walk through what gout feels like, why it happens, how doctors diagnose it, and practical steps to manage and prevent painful attacks so you can protect your joints and maintain a good quality of life. In this chapter, we focus on the sudden onset of gout and how it typically announces itself. Many people wake up in the night with shocking joint pain, often in the big toe, and the experience can be so intense it feels like the joint is burning or on fire. We will unpack those first moments and what they mean. People often describe a gout attack as striking without warning, bringing severe swelling, redness, and intense warmth concentrated around a joint. Even the lightest touch, such as a bedsheet brushing the area, can be unbearable. In short, these attacks are abrupt, dramatic, and must be treated promptly to ease the inflammation. Classic gout symptoms follow a rapid progression, with pain peaking within hours and lingering discomfort for days or weeks afterwards. The big toe is the most common site, but ankles, knees, wrists, and fingers can also be affected. The adjacent diagram highlights typical joint locations, helping you recognize where gout commonly appears. The defining appearance of an acute gout attack is dramatic swelling, intense redness, and visible inflammation, often centered on the big toe. That sudden, waking pain is a hallmark, and the visual signs help clinicians distinguish gout from other joint problems, while guiding early treatment to reduce suffering and limit damage. Now, we move into what causes gout. Understanding the biological trigger gives us practical targets for treatment and prevention. At the center of the story is uric acid and the way it can form sharp crystals in joints. So let us look at how those crystals come to be and why the body sometimes fails to handle them. Uric acid is produced when the body breaks down purines found in food and cells, and under normal conditions, healthy kidneys filter it out through urine. When balance is lost, excess uric acid can crystallize into sharp, needle-like deposits in joints. The image of crystalline structures here is a visual reminder of the culprit behind the pain. Uric acid builds up for a few main reasons, and all raise the risk of crystal formation. Sometimes the body overproduces uric acid. Other times, the kidneys do not excrete enough, and persistently high levels called hyperuricemia increase the chance crystals will form. Once crystals appear in a joint, they trigger sudden, severe inflammation and pain. Who gets gout is shaped by a mix of genes, health conditions, lifestyle, and medications. Certain groups have higher risk, but gout can affect many people depending on their individual circumstances. This chapter explores the risk factors that make some individuals more likely to experience gout attacks than others. Risk factors include male sex and older age, family history that suggests genetic susceptibility, dietary patterns high in red and organ meats or sugary drinks, and medical issues like obesity, hypertension, kidney disease, and diabetes. Certain medications, such as diuretics, can also raise uric acid, so it is the combination of factors, rather than a single cause, that often matters. A surprising historical note is that gout was once called the disease of kings, partly because indulgent diets and even lead exposure in some royal households damaged kidneys and worsened symptoms. This history reminds us that environmental and toxic exposures, along with lifestyle, have long influenced who develops severe gout. Diagnosing gout starts with a careful conversation about symptoms and a thorough physical exam, focusing on joint pain, swelling, and timing. From there, doctors use tests to confirm their suspicions, because other conditions can mimic gout, and accurate diagnosis guides the right treatment plan for relief and prevention. Doctors confirm gout using several tools: a detailed medical history and physical exam, blood tests to measure uric acid levels, which are helpful but not definitive, and joint fluid analysis, which remains the gold standard for detecting characteristic uric acid crystals. Imaging, like ultrasound or CT, can also reveal deposits, and help assess joint damage. Treating gout attacks aims first to control pain and inflammation, and then to reduce future flares by addressing uric acid levels. In this chapter, we cover immediate relief strategies as well as long-term approaches to prevent crystal buildup, so you can both feel better quickly and stay well over time. Immediate relief options include non-steroidal anti-inflammatories to reduce swelling and pain, colchicine, which is particularly effective when taken early, and corticosteroids for severe attacks or when other drugs are unsuitable. Practical measures like resting and elevating the joint, applying ice, and staying well hydrated also support recovery and comfort. Long-term management focuses on preventative medications that lower uric acid, such as allopurinol or febuxostat, and drugs like probenecid that help the kidneys excrete more uric acid. For rare, treatment-resistant cases, there are specialized infusions. Consistent adherence to prescribed therapy and regular monitoring are essential to prevent new crystal formation. Lifestyle and diet changes work hand in hand with medication to reduce flare-ups and preserve joint health. This chapter highlights practical eating and activity habits that lower uric acid production, improve kidney function, and support a healthy weight, all of which make long-term control more achievable and sustainable. When it comes to food, limiting red and organ meats, certain shellfish, sugary drinks, and especially beer can significantly reduce gout risk, while embracing low-fat dairy, plenty of vegetables, cherries and vitamin C-rich fruits, whole grains, and adequate water helps. Weight management is also crucial because it lowers uric acid production and improves kidney function. Looking ahead, prevention and a positive outlook depend on early diagnosis, regular monitoring of uric acid, and combining medication with lifestyle adjustments. Emerging research into the gut microbiome and new therapies offers hope, and with careful care, most people can minimize flare-ups and preserve a high quality of life. Gout does not have to control your life. By recognizing symptoms early, combining prescribed treatments with sensible lifestyle changes, staying informed about your condition, and protecting joint health proactively, you can take control today and help ensure your joints are healthier and more comfortable tomorrow.